Hello everybody, I am Dr. Sai Vishnu Priya, Assistant Professor of Endocrine Surgery, Madras Medical College, a Consultant Endocrine Surgeon, Sai Krishna Hospital, Endocrine Surgeon, Apollo Hospital Main, Greens Road, Chennai. My topic today is iodine and thyroid disorders. Iodine in thyroid disorders could either be due to excess iodine or it could also be to deficiency. Excess iodine disorders could be either autoimmune thyroiditis, or it could be rarely thyroid cancer, or it could be hyperthyroidism. All three of which the studies are very inconclusive. So I would not like to really touch on these subjects, but I would like to really talk about iodine deficiency disorders, which are prevalent in India and which are a real cause of a real big threat, because they are the main cause of preventable brain damage in children. And the iodine deficiency disorder control program has said that by 2012 its goal is to bring the iodine deficiency disorder by about to around 10%. So how do you do this? They have brought the fortification of salt, of iodine in salt, to around 91%, but the amount of iodine salt fortification which has reached the household has been only 71%. So what do we do for this? How do we reach to the people? So there is a mission approach that has to be taken for the iodine fortified salt to reach the people. So before this, we need to know a little about iodine and what is the requirements for adults and pregnant women and children. The requirement for iodine in pregnancy and lactation is 250 micrograms, and for adults it is 150 micrograms, and for toddlers, infants and children, would be 90 to 120 micrograms. So how do they evaluate these iodine content in the regions? It's due to they evaluate by measuring the total goiter rate, that is TGR, by the urinary iodination iodine content, that is UI, and also the salt content in the iodine content in the salt. So these three things are measured to know the iodine content in that region. So how do they fortify the iodine in the salt? It's around 15 ppm, gives around 150 microgram of salt, taking into consideration that we take around 10 grams of salt per day. So this is how the program is being taken. So now, how do we proceed to the mission approach? The mission approach is like, first thing is, there should be a policy that has to be written down, a real policy that has to be capitulated. And then the next thing would be, there should be an proper action strategy to bring down the iodine deficiency disorders. What action has to be taken to bring down the disorder rate? Next will be to implement stringent actions to bring the food and safety laws for the iodine safety, for the iodine fortification. That will be the third. The fourth will be, where are the inequities that are happening for the the difference where the fortification and the reach is not happening. So where are the inequities? So find out that. Distribution, the distribution of salt program, the program's distribution will have to be done. The next thing will be maintenance and stability. So this will be the mission approach. Disorders in pregnant and lactating women, in children and adults. When a pregnant or a lactating woman is iodine deficient, she in turn gives birth to a iodine deficient child who could be either neurologic cretin or a myxedematous cretin. A neurologic cretin is the one with a brain damage, who could either be a mentally retarded, short statured, deaf and dumb, and reflexes lost, and the other thing is iodine supplementation cannot reverse the damages. While a myxedematus cretin, there is a chance for iodine supplementation can reverse a few of the changes, and he might present just with short stature. In children, they present with cognitive and somatic growth disturbances. In adult, as usual, they present with goiter, and also there are incidences where follicular carcinoma and anaplastic carcinoma have been found to be present in deficiency areas. So with this we can, I would like to conclude saying that iodine supplementation is very much important, and iodine deficiency has to be definitely corrected because in India we find that iodine deficiency is an endemic area. India is endemic area, and iodine deficiency disorders have to be definitely taken in consideration.